Welcome back, everyone, to the System of Care Virtual Summit 2024. I am Dr. Gia Kelly, and I am so excited to be able to be the host for this session as we get ready to dive into a wonderful presentation by Dr. Tanisha Freeman Foster on the tale of two systems. Where are the Black and Brown youth and why are they there? If you are excited for this session, go ahead and give us some emojis, give us some hearts. Come on. I need the energy in this room live because this is going to be a phenomenal session. Come on. I see it. I see thumbs up. Great. I see hearts. I see excitement. All right. I got some people here who are ready to go. So I'm going to get out of your way really quickly. But before I introduce Tanisha, I want to just say, to remind you all to please make sure that you put any questions that you have in the Q&A and not in the chat. We want you to feel free to put all your emojis and your gifts in the chat. But if you have a question that you want Dr. Tanisha to address, make sure it is in the Q&A, which is located to the left of the chat. All right. Everybody good with that? All right. Just want to make sure that we can get to your questions. So without further ado, I am going to introduce our keynote speaker. Dr. Tanisha Freeman Foster is the co-founder of Lead Us Well. She is a transformation and solution-focused leadership and organizational culture expert with nearly 20 years of experience working with individuals and organizations nationally as a consultant, a coach, a mentor, and a trainer. Dr. Freeman Foster is most passionate about addressing inequities, workforce and client engagement, and mental wellness for youth, young adults, and historically marginalized individuals and communities. Without further ado, I'm going to pass it over to Dr. Tanisha to dig into today's session. Thank you.
Awesome. Thank you so much, Dr. Gia, for this introduction. And thank you all so much for the fire, for the hearts, for all the things in the chat. It sounds like music, even though we don't have theme music. So this is exciting. So I am coming to you all today from Tampa Bay, Florida. It is the land of the Seminole people. If you can acknowledge your land that you're currently on in the chat, that would be phenomenal. I just want to say thank you to NTAC and all the phenomenal staff here today for the opportunity to be present today. I also want to thank Dr. Ashley Stewart for her presentation and really launching us and singing us into day two. So coming in on that energy. So as we start, as we are grounding ourselves in our land and being present, I want us to take a moment and ground our humanity. So if you could do me a favor, if you are able to take a hand and place it over your chest, and we're just going to breathe for a second. All right. So if you could put in the chat, what is one word that came up for you while you were doing that? Just one word that came to you while you were doing that. I see peace. I see relax. I see comfort. Yes, thank you so much. And this will be interactive, so stay tuned for that. So what came up for me is breath. And I always say that breath equals life and life equals opportunity. It's an opportunity to do better, to be better, and to make a greater impact on the world. And so I want us to ground ourselves in that, ground ourselves in our humanity, ground ourselves in the opportunity to be better. And I want to say that none of us should have ever arrived anywhere, that the only way we arrive is when we're no longer on earth, that there's always an opportunity to do better. There's always an opportunity to make a better impact. And so as we focus today on the tale of two systems, we're going to take an introspective look. We're going to look internally. I found that a lot of times when we talk about disparities and inequities, we look at sources beyond us, but it's really important for us to look at ourselves. And so that's what we're going to be doing today. We're going to look at disparities through the lens of us. of humans, of how we can do better and how we can be better. All right, if you're ready, please put ready in the chat. All right, so Dr. Gia introduced me, so I'll just give you a quick blurb again. I am Dr. Tanisha Freeman Foster. I am the CEO and co-founder of Lead Us Well. We have three principles that we believe in, three pillars: learn well, lead well, and live well. And I like to say that I have a healthy obsession with all things leadership. And that came about as most of my career I've been in leadership, but I've always really taken a look at how leadership impacts organizational culture, how leadership impacts client outcomes. And I believe this was really cemented for me at an early age, and being in healthcare and doing clinicals in high school and so forth, and being able to see the disparities in how people were treated in the nursing homes and in the hospitals based on their insurance status, based on their zip code, based on their race. And it made a big difference in their quality of life. And that really opened my eyes to how us as human beings have an impact on individuals. Yes, there are systems at play. Yes, there are systems that impact the services that people receive. But as human beings, we impact the quality of care. And so being intentional about that. Also, during my dissertation, I did research on HIV, and I did research specifically on how organizational culture and organizational leaders impacted individuals who were living with HIV, impacted their decision to take their medication, their decision to go to their medical appointments, and even their will to live. And what I found is that things that were so simple that we could do as human beings made such a huge impact. So things such as someone having a medical appointment at 12 o'clock and no one coming out to see them into 1 o'clock to call them in, when in between they could have said, the doctor is running a little late today. We'll see you in a little bit. Is there anything that you need from us? A glass of water, a bottle of water? Instead, they were left there in the lobby to just wait. And so when that happened, people didn't feel seen, they didn't feel heard, and they didn't feel celebrated. And it actually impacted their willingness to live. A lot of them gave up. They no longer wanted to live because they felt like if their doctor and their medical care team did not see them as important, then maybe they weren't. That if they did not see that their life was important for living, then maybe it wasn't. And so they would give up a lot of times. And I thought to myself, that is way too much power to have, first of all, as leaders. And it's way too much power for us to have and not be doing things constructive with it. And so a lot of my work comes through the lens of leadership, both empowering staff and also empowering leaders, but also empowering clients to not just be clients, not just be patients, but be participants in their healthcare. And so, again, that is the lens that I'm coming to you all with today. I'm also excited. This year, I wrote my first book. I am also the best-selling author of the book, Navigating Rough Seas, Soul Eroding Assimilation Forcing Systems. And it is a playbook for individuals who are navigating workplace trauma and helping them to reclaim their power, their wellness, and their joy. And so again, that lands on doing better. How do we do better as leaders by everyone within the organization is important to me. And so I'm going to ask you this question. What does it mean to belong? And you can think of a group that you may be a part of, a family that you may be a part of, a virtual group, an in-person group, a religious group that you may be a part of. What does it feel like to belong? And you can share that in the chat. I see to feel accepted. I see to feel connected, to feel loved unconditionally, knowing that you matter to others, feeling a sense of safety, feeling heard and seen. So I want us to keep that in mind when we talk about our clients, when we talk about the children, the adults, the families that we serve. Are we creating this same sense for them in our organizations? Are we creating this same sense for them as we provide services to them? Are we creating this in our administrative and our leadership roles, in our decision making, are we making sure that people have a space to belong, and not the space that we create for them, but we co-create with them, that we're not creating boxes and say, here's a box, either you fit in it or you go elsewhere, but we are really being intentional and innovative about creating diverse and innovative spaces where people feel a sense of belonging. Okay, so what is a disparity? This is something that we are going to be focusing on during our session today. So when you think of disparity, what comes up for you? I see lacking, lack, poverty, disconnection, loss or lack, unequal. Yes, thank you for sharing that. So here are some things I looked up. I researched what is a disparity, and I found what a disparity is gaps in the health status, health outcomes, quality of treatment, or access to care among various populations. So I looked at various definitions and I'm like, okay, this seems to capture it. But what I also wanted to put on here is that when we think of mental health disparities, mental wellness disparities, what we found is that these disparities are faced by racial and ethnic minorities, even after controlling for variables like income, insurance status, age, and symptom expression. So out of all of these things, it didn't matter what was going on with that individual, just based on their race and ethnicity, they were experiencing disparities. And so what that told me is, yes, we look at systems, and systems do play a huge part in our services, but this is a human. This is a heart matter. This is a heart condition. What is going on within the organization that even after controlling for income, insurance status, age, and level of symptoms, that people that are Black and brown are still facing disparities? And so again, this was my goal, to look internally, because this says it's something bigger than private insurance. It says it's something bigger than Medicaid. It says it's something bigger than being a child or a young adult or older adult. It says it's about race and ethnicity. And these are among other things, but this is something that's at the foundational level. And again, this is something that I feel like, and I strongly believe, that's within our control as human beings. Right. So my next question is, what is a system? So when you think of a system, what comes up for you? Or who comes up for you? Because sometimes we think of a system as this thing, and sometimes it's the person, it's the man. All right, I see an organization, the government, I see the man, I see the healthcare system. Thank you for sharing. So what if I told you the system was each of us, that each of us as individuals come together to create a system? And I want us to really ground ourselves in our humanity again, because when we think of the system, I think when we think of something being controlled or being exacerbated by a system, it forces us to look at a space beyond ourselves. We look beyond ourselves for a solution. And I really believe that a lot of the solutions that we're looking for externally are within each of us. And so it assumes, again, when we say this thing is happening because of a system, it assumes that we're powerless, that we don't have any power or control of change, and we don't have any power to take action or dismantle the things. And so I want us to, again, keep in mind that, yes, there are things that are exacerbated and contributed to by the system, but there are things that are within our control. And so when I think of a system, I want us to think of ourselves. I want us to think of our humanity. And so what is a system? Again, I did some research on this. It is a regularly interacting or interdependent group of items forming a unified whole. And so again, we can insert people in here. A regularly interacting or interdependent group of people forming a unified whole, forming a mental health system, forming a healthcare system, forming an educational system, human beings. It is also a set of principles or procedures according to which something is done. And what I like to say, it is a manifestation of human mindsets and perspectives that have been formalized and implemented. And so, again, when we think about how people are treated within the system, if we think certain individuals of certain races are really not interested in mental health systems, we form a system around that. We form a system around our services being provided at a certain time. If we're doing home visits to certain areas or not, what type of services are we providing? What times are their services? And so even if it's subconscious, we're still creating policies and procedures around a belief. And those policies and procedures create a process of action, and that action becomes the system. It becomes a systemic way of doing things, but it all starts with our minds and our beliefs around who is going to thrive and who is not going to thrive based on what we believe about that group of individuals. All right, so the key question is, even as we think about systems, like what is the impact? How are systems impacting individuals? How are organizational systems impacting individuals? What are the impacts to the community? What are the impacts to the clients? And which of these things are happening within your organizations? How are clients being impacted because of the systems that you have implemented within your organization? And so that was actually a rhetorical question. It was also a question for you to think about. But we're going to talk about what the data says about it. So what does the data say? The data says that almost half, 44% of high schoolers reported feeling persistently sad or hopeless within the last year. And this is data from 2023. So this is not data that came strictly from the period of COVID. This is recent data that says almost 44% of high schoolers reported feeling persistently sad or hopeless in the last year. And the three things that they found that were the greatest contributors were racism, stigma around gender and sexual identity, and sexual violence. And so as we think about systems and we think about the individuals that we're serving, we have to, again, be mindful that we're talking about human beings. So looking at the lens of this through a human being and not just numbers. And sometimes it's easy for us to get caught up in like, oh, it's 44%. It is nearly 5 out of 10 human beings, 5 out of 10 high schoolers. And these are just the high schoolers that responded to the survey. And so if we think that at least 5 out of 10 responded and said this, how many others did not take the survey or maybe not present during the survey period or just chose not to respond that could also be experiencing this as well? And the more I thought about this and I placed myself in the shoes of high schoolers and I thought about what it could feel like to be hopeless at almost the beginning of your life. Like you're still a young person and the world is about to open up so that you could do it, whatever you chose to do and live your dreams, and what it must be like to feel hopeless, what it must be like to feel that this is as good as it gets. And then we look at that, and there's no wonder that we have such high suicide rates and suicidal ideations among young people. And so again, what does the data say? It says that racial discrimination is linked to increased depression and a greater odds of suicidal thoughts as early as age 10. And so this is based on research of brown and Black youth who were called and asked specific questions about their mental wellness and about different things that were occurring in their life. And we found that as early as age 10, that young Black and brown boys were thinking about suicide. And again, that's something that we can intervene in as human beings. How do we reach these individuals? We also know that deaths due to drug overdose among adolescents more than doubled from 2018 to 2022. So in 2018, it was 253 deaths. In 2022, 723 deaths. And the largest increases were among Hispanic and Black adolescents. And then as we talk about race and ethnicity, we also talk about gender, because there's a definite intersection between these. And so I don't want to leave that out. I would be remiss to leave that out and say that there's not an intersection. And so LGBTQIA students, and students who had the same-sex partners were more likely than their peers to make a suicide plan. And so again, we look at this through the lens of race. We look at it through the lens of stigma around gender and gender identity. And we look at it through the lens of coping. How are young people coping with the things that are happening around them? And as adults, what can we do better? And so throughout this presentation, I want us to reflect on that. What can I do better? And even if you're doing your best, there's always something better that we can do. Even if we feel like we're giving the most, there's always a little bit more that we can give. And so the goal of this presentation is not to point fingers. It's not to say you're bad and you're good. It's what are you doing and how can you do it better? How can you give more? How can you look at the quality of services and the quality of your interactions with young people and their families to improve their outcomes? All right. Are there any questions in the chat so far? And I see something about tribal youth. We do have some data around tribal youth as well.
Yes, I can read those questions. There was one on the screen. I wanted to acknowledge just one that was given earlier, and they wanted to know if you had any recommendations for creating belonging in new groups. I think when you started off, you talked a little bit about belonging, and that was one question.
Absolutely. Yeah. So I think based on my experience, there are various ways that we can create belonging in new groups. I think first, we know based on experience that some of the strongest referrals come from self-referrals from people that know each other. So they've been referred by a friend. I also think creating belonging, what we've done in previous programs is had an orientation so that people can get to know some of the staff and some of the peers that are involved with such programs, so that you're not coming to group on a Tuesday night and you're like, okay, when I open the door, who's going to be on the other side? But that there's a warm welcome that comes prior to. We also created videos of individuals that have participated in the programs, and they told their story about how they had times in their life when they were down and how they thought about taking their lives or how they attempted suicide. And because of the program and because of the interaction with the individuals, it inspired them to live. It increased their hope. And so those videos were also a part of that orientation. So again, people got a glimpse into who are the staff in this program, what is the goal and purpose of the program, and also how the program has impacted other people. And when they went to group, they were able to see those faces. They were able to see the faces of the staff there. They were able to see the faces of the other participants there and ask questions. And I think it's also a good question because as someone who served as a project director, it was amazing just to stand back and watch young people enter into groups and watch that group create a sense of belonging without saying any words, where people just knew that they fit. And they would say, for the first time, I feel like I fit somewhere. And it was just something magical and silent that took place. I can't even describe it. It was just beautiful. And so I think they're a combination of things.
Thank you so much, Tanisha. Did you want any more questions or did you want to come back to it? We have a couple more.
Sure, we can take one more.
Okay. One question, I'll kind of combine these two because they're just around the data. The first one wanted to know if Indigenous or First Nations youth were included in the data that you talked about. And then the other question was, where did the data come from? Was it US data or somewhere else?
Absolutely. Yes. So it is US data, and some of the data has native voice in it and some of it did not. But what my goal was is to try to piece it all together and bring all voices together. And so there are multiple ethnicities and tribal voices that have been put into the data. Yes.
Okay, I think you can continue. We can come back to questions when you're ready again.
Okay. Thank you all so much for your great questions. And so the next question is, how do we reach young people? And so again, we're going to look at this from a human lens. And what I am fascinated about is human behavior and human culture, and also being curious, asking curious questions around data. So I really appreciate all of your questions. And one of the things I like to laugh about is I used to be obsessed and still am obsessed with like murder mystery shows and 2020 and law and order shows, because it always keeps you curious. It keeps you asking questions. And so I had this thought of being the code detective with Detective Stabler from Law and Order. And so I want us all to put on our curious hats as we look at these data. I want us all to remember this human centered. And so if you can pause here, and we're going to put on our detective hats, and we're going to look at these questions from a curious lens and look at them thoroughly. And so what this means is that we're not going to look at the data in silo. I found sometimes that we look at data and we say, okay, this is what's happening to young people. This is what's happening to babies. This is what's happening to young adults and parents and staff, but really take all of those things and open them up and put them on a table. So we're going to put them on our detective table, and we're going to look at trends. We're going to look at what's happening across the age range, so that we can have a better understanding of how to really create some innovative strategies around this. All right, so how do we reach them? So what we know is, where are they at? So in 2021 and 2022, only 20% of adolescents reported receiving mental health therapy. And this is 2 out of 10 people, 2 out of 10 adolescents reported receiving mental health therapy. And so we know that there are a lot of adolescents who could benefit from mental health therapy. So having 2 out of 10 is really a red flag. And so where are they at? Where are the adults at? And so that is my thing. We know that young people are, as minors, they are in families. They have adults or caregivers, or if they're involved in the system, they're still an adult that is attached to that child unless they're emancipated. And so that was the question that came up for me. If the young people are not in care, where are the adults? And do the statistics and the data for the adults mirror those of the children? Uh-oh. Go back a slide. Okay, so where are they at with the adults? So we have, based on our data, 5 out of 10 individuals who identify as white receiving services. And these are individuals who have been diagnosed with any mental illness within the past 12 months. And so these are the individuals who actually need services. And these are the individuals that are actually of that group receiving services. So we know that 5 out of 10. So out of every 10 individuals who were in need of mental health services, 5 received services. We know that for American Indian or Alaskan Native, that 4 out of 10 received services. For Black individuals, 3 out of 10. For Hispanic, 3 out of 10. And for Asian, 2 out of 10. And so again, if we look at the 20% of young people, a lot of the data mirror that for adults as well. So we can see that there are some trends among who's receiving services. I think my slides are sticking. Okay, here we go. Okay, and so my next question is, where are they? So looking at the staff, where are the staff at? And so I pulled the data and I looked across ethnicities, I looked across tribal groups, and looked at the number of individuals who were social workers, counselors, and psychologists by race and ethnicity, and also the number of individuals who are receiving services, the number of individuals who had any mental illness and actually went in for services. And so we could see two things from this data. And I put them together and I overlaid them to create this chart. So two things that came up for me was, first, if we look at this, individuals who are white are the only group of individuals who have an abundance of social workers, counselors, and psychologists who look like them. And so when we talk about access to services, and we'll talk about individuals who are seeking people who look like them, people who have a shared race and identity. And so if we look at it from that lens, we're always going to miss a group of people who are not coming because they don't have anyone to relate to them based on ethnicity and race. So we look at white, we look at Black. Again, now this is where we start to see the disparities. There's an increased number of Black individuals, increase in Hispanic, and increase in Asian individuals who do not have an abundance of social workers, counselors, and psychologists who look like them. And so once we start getting to the American Indian and Alaska Native and also Native Hawaiian and other Pacific Islander, it almost goes to zero. And this is another red flag because we know individuals from this group are in need of mental health services and that they deserve that. And they deserve to see someone who looks like them if that's what they choose. So when we talk about access, it's not just the building. It's, do I have access to what I need to thrive? And if I say I need someone who looks like me to be able to facilitate this service and it's not there, then I don't have access. And so again, looking at it beyond what we have on paper, looking at it beyond a building, or we have programs for everyone, or we have programs that are in the evening. Do you have what people are asking for? And so looking at this also, it raises questions about how do we recruit individuals? How do we mentor these careers for young people? And so if people are coming in and receiving crummy services or not coming at all, most likely they're not going to choose this major. They're not going to choose to go into mental health. And so that creates a problem, again, with the pipeline of individuals coming from educational fields into these mental health fields. So how do we get them in, not only to serve them, but to help them create a narrative that these services are beneficial, that they are worthwhile, that their voice and their perspectives are needed, and so that people can be well. And so those are two things that came up for me with this. If you have questions about this, put it in the chat. And I see someone, we'll pause right here. Do we have questions around this? I see someone says, what does that pipeline look like? And I think that's a really, really important question. And I think the pipeline starts at elementary school. It starts at preschool. And so as we look at going into the store and we see dolls and books on being doctors, medical doctors and lawyers and firefighters and all types of things, do we see that same image playing out in media for mental health? When do we have books for children that talks about what it means to be a therapist, what it means to help other people with one of the most important aspects of their life, which is their mind? Because the mind controls everything. So if we can help people heal their mind, we can help them thrive. Where are those books at? Where do we have days within our office where we know we have days where parents can bring their children to work? Do we have that in our offices where parents can bring their children to work, or you can bring your kids to our office? We want to do a staff day and we want to show young people what it means to be a part of the mental wellness system. Do we have days within high schools where we go out and it's beyond setting up a table for a health fair, but it's actually talking to individuals about a career in mental health? Do we talk to them about what classes may be needed for them to be in this field and what are the rewards of that, and start to put them on a path to take the classes that they need to start going in the direction of working in mental health? And so I'm not seeing that a lot. And I think there's a lot of opportunity that comes with that there are a lot of things that we can do to really increase awareness about mental health and mental wellness and the need and also the rewards that come along with that. Salary, I know that is something we have to talk about that, about people having a thriving wage. And again, I think there are innovative ways to have those discussions. And there are things that we can do within the organization to make sure that people have a thriving wage, that it's not just a livable wage where people are living paycheck to paycheck, but a thriving wage that allows them to be able to do some of the exciting and fun things they enjoy with their family and loved ones.
Thank you for that, Tanisha. I had another question, and I just want to let folks know there's a lot of questions, and I don't know if we'll be able to get to them all, so I'm just going to pull some out by upvoting those that have been upvoted. And one was, how can we support youth in rural areas where there is a lack of access to safe and supportive free groups and community resources? They also say that a lot of their youth struggle with transportation concerns in the office. And so that's one question.
Yes, thanks so much. And thanks so much for these questions. And I think there are various ways. And so we know in rural areas, things tend to be more spread out. It takes longer to get places. But what I would say is that I think it really requires us to really map out where are the young people, almost create a map of where are young people at, and where there's central points where we have a concentration of young people and can bring some of the other young people in the surrounding areas to those spaces. And so it may not be in the office, it may be in the community. I would also say partnering with innovative partners. Sometimes we call them non-traditional, but I'd like to say innovative. Who are the organizations within your community who have access to resources that can partner with you? And what I believe is that mental health touches everyone. Mental wellness touches everyone. Someone that you just ordered food from, or just delivered your food, or the person at the bank, or the person next to you at the red light or in the grocery store, everyone is impacted by mental health. And so sometimes we get stuck and it's like, oh, I don't want to ask them. Everyone is impacted by mental health. And so if we paint the picture in that way, people will be more likely to help us and to partner with us. And I'll share an example of something we did. We had a program for adults that were coming out of prisons. And one of the things we did was work with our local churches, work with our local community-based organizations. Those organizations have space. Those organizations, a lot of times their space, especially if you work with churches, most time it's like Tuesday night Bible study, Monday night prayer meeting, and Sundays that the churches are being in use, and other days of the week, those facilities are empty. And so how can we work with those? We had a church that we were able to subcontract a room in their church with, and they allowed us to outfit it for young people to be able to have groups there. These churches also have vans. They have daycare centers. And so we were able to have programs within the churches where people could bring their children with them. And we contracted with the church to provide additional hours, like pay overtime to their daycare staff to be able to keep those kids in there and make sure they're safe while we had groups. Also, the church vans, that's transportation. Those vans are sitting there most days of the week. And so how do we partner with that? We also partner with individuals with car dealerships to be able to provide transportation at a reduced cost to individuals. And so I think sometimes we get caught up in looking at social services and health services, and we forget that there are so many people who are impacted by mental health. People at your local grocery stores, people at your local bowling alleys, and things within your community that would be more than willing to help if we ask them. And at the worst, all they can say is no. And we'll live through it. We'll live through a no, but at least we know, and they know that we have a need, and they may have a friend or a colleague that can support us. And so I really think it comes down to asking the question, really taking a look at who's in your community and approaching them and asking them. It may not be their kid, but it's all of our kids. It's all of our families, and everyone's impacted by it. That mom or that dad works at a place that is also impacted by when they're not well. And so just thinking about that through that lens, that human lens, and that detective and curiosity lens, I think is important.
Thank you, Tanisha. Did you want any more questions?
We can take one more.
And
also, I spoke with Ashley, just for everyone to know, I spoke with Ashley prior to this session. And what we'll do, we'll try to go through and collect the questions. Please make sure you put questions in the Q&A section, and she'll send me those questions and I'll go through as many as possible. And we'll do a recap next week, and I'll answer as many questions as I can get to if there are unanswered questions in this session. So please make sure you put them in the Q&A. I'll be happy to address them.
Sounds good. One of the questions that was upvoted quite a bit was, do you have any suggestions for them as family support to better educate parents as they often dismiss the suicidal ideation of their children?
That is really tough, and that is really big. And I think with family support, I think really having a conversation about that with parents in a way that removes them from the equation and allows them to walk in the shoes of their young people, allows them to walk in the shoes of what it must be like to go to school, what it must be like to be bullied. Because I think a lot of times what happens is that parents get caught in this conversation, and it feels like bad parenting. And so when it feels like bad parenting, parents shut down like, oh no, so you're saying that my child has a problem, that means I'm a bad parent. And so if we can remove them from that and create a space where they're able to have some empathy and walk in those shoes as a friend, as a supporter, what would you do if your next door neighbor child came to you and said this? And most likely they would not respond in that way. And so I would say finding ways and intersections to remove them from it so that they can come in as a friend, so that they can walk through shoes. And also, as you're doing that, I think really level setting and letting them know how much the world has changed, that a lot of times people struggle with that. And they're like, well, I was bullied when I was younger and I never wanted to do that to myself. And so really creating that scenario around, so when you were younger, there was no Facebook, there was no Instagram, there was no TikTok, there were no apps. You probably didn't even have a cell phone and a computer. And so even if you were bullied in school, at 3 o'clock, the bully went away until the next morning. For your child, it's 24/7. Someone's posting on Facebook, someone's posting on an app, someone's on computer. And so it doesn't stop. And imagine, what if the bully never went to sleep, that it was always awake? And put yourself in those shoes. And I think really painting that picture of it is a different time in a different culture. And that's why you're receiving a response that's different than what you would have done when you were younger.
That's wonderful. And then one more, and I'll hand it back over to you. Someone asked, how can we empower families to share with us what makes them feel judged or stigmatized? We do so much on cultural awareness, but things change so quickly, it is hard to know what may be perceived a certain way, even if that's not the intention.
Yeah, that's a great question. And I really think with this, it's really asking those curious questions to find out what would a good experience look like. And so again, removing it from yourself, what would a good experience look like? If you could dream, and I love the magic wand questions. I am a fan of the magic wand and the dream questions. If you could dream of a premier mental health system, or a mental health system that helped you feel a sense of belonging, what would that look like? Like, what are 5 things that you would want from that system? And starting from there, and once you receive those things, asking questions around what that means, and asking questions around, has there ever been a time where you felt like you belonged? And what did that feel like for you? And how can I support you in feeling that way again? What are your thoughts around how these services should be provided, or what is needed, or what is missing? And I think that, but I really think starting people at a dream, because most people, once you ask them about what they dream of and you remove all those boundaries and all those barriers, people are able to have a real conversation. And so coming in and not making it personal, but asking questions, and also being open to the things that people say, even when it feels uncomfortable. Because I found that a lot of times people shut down because they're afraid, like they need this service for their child and it's not going well. But not going well and having it is better than needing it and not having access to it, or fearing that your child or the person that you're caring for or yourself will be retaliated against for speaking your truth. And so asking the question, but also doing your work before you go in there and sitting with the fact that if they say, I would really like somebody Black, or I really like someone that is Native American to provide these services, and that's not you, being okay with that. I think that is huge, because people are often afraid. Now, they have conversations at the dinner table and with people they know, but you want them to have those conversations with you. And so you have to be able to sit with that and not take that personal. And really, again, look at it from a human lens of what is for the greater good. And even if I went to school for 50,000 years and I know mental health in and out, if what I know and my presence and my experience is not helping this individual or this family be better, that I have to take a step back. I have to take a step down and connect them with whatever's going to help them thrive and be their best self. All right, so where are they at? And so this was a study that was done with individuals who were between the ages of 18 to 75. And it is divided by race. And this one did not have a Native American or Asian response rate in it. So that's why it is not on this screen. But again, this is important that we hear all voices and that we make sure that everyone has a place to belong and speak. And I think within this, I put this in here knowing that the voices were missing, but at the same time, I feel like it's an opportunity to find the answers to the questions we need. And so I think as we look at research, there always going to be some voice that is missing. And I think when I think of that, I think of me in school and how there's always an opportunity for further research, an opportunity for more questions, an opportunity to be curious and to see what that looks like, to see what it looks like for Native American and for Hispanic and for Asian, or for Native American and Asian populations. And we also know that this study is 18 to 75. What does that look like for 10 or 12 to 17? What does it look like for younger people? And so knowing that our research is not absolute, that it's an opportunity. It's an opportunity for a conversation. And so with this being said, we look at where are people at? So we know for Black individuals, 43% say if they had mental health challenges, that they would wait and see if they could manage the symptoms on their own. 43% of people are trying to manage it on their own. 47% of Hispanic and 35% of white are saying that they will wait and see. They will wait and see how the symptoms go, try to manage it on their own. Then we have that the next level would be seeking advice from family and friends. So 32% of Black, 39% of Hispanic, 26% of white. And again, if we're talking about groups of individuals where we know in previous slides that only 20% or 30% of individuals are seeking mental health services. And so now we have 32% of individuals, for example, Black individuals seeking advice from family and friends. The first thing is so if 20% are receiving services and 32% are seeking advice from family and friends, what are they telling them? And so when we think about services and we think about how people are being treated, we also have to think about the stories that we are creating. So if someone comes to our organization to receive services and they don't have a good experience, that's a story. That is a story that they're going to go and tell their children, their grandchildren, their community members, and that's going to impact how people receive our services if they even come into care. And so really looking at all of the things that this touches. So seeking advice from family and friends, learning from social media influencers. So we have 22%, 26%, 16%. And I wonder with this, is it higher among young people? Are there more young people seeking information from social media influencers? And then we have, which I thought was really powerful, individuals seeking support for their mental health from community and religious-based organizations. 35% Black, 33% Hispanic, and 25% white who are seeking services from places other than a professional or formal mental health center. So for me, again, this brings up, well, maybe that's where we need to be as providers, that we need to be in the community. We need to be partnered with community partners, the YMCAs, the grocery stores, as many partners as we can, and really move outside of what we know as traditional providers, really look at innovative places. And then if we have people who are waiting to see how the symptoms go, then we need to be really tailoring our message to that. If people are waiting to see how it goes and see if they can handle it on their own, what would it look like to have media and to have brochures to say, okay, this is feeling sad and this is depression. This is you're a little tired and this is something bigger that's going on, and meet them where they are. And so again, if we're meeting people where they are, this is where they are, and how do we tailor services around that is very important. All right, so what are the root causes? And so again, we're going to look at systems, because systems do impact, and it is a factor. And so systems, we're looking at inadequate access to medical health services, less access to the best available treatments. And these are things that happen with Black and brown individuals and communities. And I just put them together on this slide. Insufficient funding, disproportionate racial and ethnically diverse providers, systemic and structural racism, incompatible and outdated evidence-based practices. And those are things that affect it. So when we talk about access, again, access is bigger than a building. It's bigger than the number of programs that we have. It is the services that we provide. And are we using outdated evidence-based practices? Are we using practices that were not evidenced with the individuals who we are serving? And so humans, these are the things that human beings have control over. And these are the things that are impacting client interactions based on the data that people are reporting, that when they go in for services, that they receive poor quality treatment services, that they don't get the best that's available, that there's provider discrimination, biases, and stereotyping, that a lot of times they feel overtaught, that they are unable to share how they're feeling. And there actually research on that around client and provider communication, and how a lot of times with Black and brown individuals, the doctor or the provider talks more than they talk. And so they feel unheard. And it doesn't happen with other groups. Also, over and underdiagnosed symptoms, that someone comes in and they say, you know, I prayed and the Spirit spoke to me and it told me that I just need to be patient in this season of my life. And they are diagnosed with schizophrenia or other things. And so, or underdiagnosed, that they're not believed about their symptoms. Also, we have a lack of client voice and choice, a lack of cultural understanding and references. Also, here's another human aspect when it comes to organizations. We have microaggressions, racism, abuse, and oppression of staff voices, innovation and evolution, adverse leadership, lack of community awareness and involvement. We just out in the community serving people. We have no idea what is going on in the community, and we're not listening to the people who know what's happening and know how to make a difference. Also, homogenous decision making, apathetic approaches to inequities, that we just look at the inequities as a number, that we forget to see the humans behind them. Where do we go from here? We are the system. And so if you don't take anything from this, I will leave you with 3 takeaways. First, resilience is not a pass for a lack of accountability or responsibility. That we wouldn't have, for example, if you woke up and one of your teeth came out, you wouldn't say, oh, well, I guess the other teeth that stayed in overnight were resilient. Like, you would go, and that would be a crisis. Like, what happened? What did I eat last night that made my tooth fall out? And I could have all my other teeth and that tooth fell out. What is happening? And so we need to approach this from that angle as well. Also, measure what matters and take meaningful action. If we're really concerned about inequities, we need to measure them at all levels. And then take care of your first customers, which are your staff. So we talked about this. Resilience is not a past. Listen to the client. Again, we talked about individuals who are looking for people who have shared race or ethnicity, similar life experiences, and understand their sexual orientation and gender identity, which is super important. All right. Lastly, humans maintain systems. We can practice cultural humility consistently, interrogate what you think you know, hire, engage, and promote Black and Brown staff and LGBTQ2 staff as well. Partner with racially and ethnically diverse, religious and community-based groups, and innovate with racially and ethnically diverse youth, young adults, and families. And we talked about this. And we're going to move up for sake of time. And this is just something to think about. How many people did your organization serve last year? And how many lives were enhanced? So if I asked you how many people your organization served last year, you would probably know the answer. But when I ask how many lives were enhanced as a result of your services and how do you know, that creates a pause. And so we want to make sure that we know without a shadow of a doubt, how are we impacting people, and not just guessing, but that they told us. All right. And so as we close out, I just want each of you to know that a positive difference is a decision away. I want you to take your hand again and place it on your chest and just pause and know that you have the ability to make a positive difference in the world. All right. And then share in the chat one action that you can and will take within the next 7 days. And I want you to leave, be brave, be bold, be beautiful, and be you. All right. And you have a free gift. Again, my journey is filled with lifelong learning. And so I would love to hear from you all of what you enjoyed hearing, what you would like to learn more of, and then you receive a free gift of 6 strategies for addressing mental health disparities. And here's my connection information. All right, I will turn it back over to the host. Thank you all so much.
Thank you. Thank you so much, Dr. Tanisha.
Thank you, Dr. Tanisha Freeman Foster. You see all the hearts, the hand claps, the wow. Thank you so much. Thank you to Gia. Thank you to Crystal, our ASL interpreter for today. We appreciate it. So we are about to go into a 30-minute break. But before we leave, I would love for us to take a moment to look at the notes, the visual notes from today's session. So we are going to invite Yen to share her screen and show us the visual notes. This will also be shared in the visual summary booth found in the booth section. Lots of hearts going up. I love it. As we're taking in these notes, maybe put in the chat what's standing out to you. And again, we will make sure that this is available to everyone. Okay, so we are going to, like I said, go into a 30-minute break. And then after that, we have concurrent sessions, our second set of concurrent sessions for the day. So we hope that you'll come back and join us. What we like to do at the summit is something called the read the feed. So remember, there's the session chat, and then there's also the event feed. So we would love for you to respond and reflect on some learnings from Dr. Freeman Foster. And the question is, Dr. Freeman Foster said, when we think of a system, we should think of our humanity. So I would love for you all to put in the event feed to share an example where your actions influence the system positively. So as you're going out for your break, just share with us in the event feed actions that influence the system positively. Okay, I hope that you all enjoy your break, and we will see you back here shortly. Take care. Get some water. Stretch your arms. We'll see you soon.